It is a great pleasure to be part of this inauguration of WIN Center for Maternal and Child Health and Water and Sanitation. These two centers address the fundamental needs of a society. Society cannot be there without water and without mother. So both of them are also very fundamental areas of work for public health, for which our institute is dedicated. Unfortunately, public health is much needed but very little understood in our society by our government, by our people, media and the private sector. Without public health, society will remain sick and diseased. No matter how many hospitals or even new aims we may open, but that cannot replace public health. Just now having tea, one of the alumni of IIT, who is a professor in Columbia University, told me how he had dengue fever when he came. So he says, your public health is very poor, but treatment of dengue was very good. It was better than US. So we have much better treatment, but much worse public health. And that is where our institute as well as this initiative is very, very relevant. The government of Gujarat has boosted public health by recognizing IIPH, which is a very small institution as compared to IIT, as the first public health university through the State Act of Gujarat. We run Master of Public Health and Hospital Administration courses and will soon start PhD. We can learn a lot from what Dr. Jain said in terms of not only building public health leaders, but true citizens for the society. We have a long way to go in public health in India. Some of our indicators are 5 to 10 times lower than our neighboring countries like China, Sri Lanka and Malaysia. The whole society has to help, public health has to improve. The industry, philanthropists, governments all have to come together along with academic institutions and work together in this multi-sectoral area of public health. We must thank Chirag Bhai and his family for this generous support for the two centers for maternal child health and water and sanitation at IIPH and IIT Gandhinagar. The purpose of these centers will bring technology to public health practice and bring innovations in science and apply them to daily practice of these two sectors. The sectors and centers will look for innovations and field test them on real site near Ahmedabad or Gandhinagar and prove their effectiveness, cost effectiveness, and how to scale those in the villages as well as urban areas of Gujarat and the country. The vision of the center will be to bring the fruits of technology, which many of us are enjoying, to people's health and well-being at a low cost. These centers will work with various stakeholders, the government, NGOs, academic institutions, students, teachers, community-based organizations, and even if required, with political parties, religious organizations, so that the available technology can be brought to practice in day-to-day work of public health and medicine. The centers will also inspire young students and researchers to take up the challenge of technology application in public health. And thus it will link to various missions, national missions of Swachh Bharat, Swasth Bharat, Smart Bharat, Digital India, etc. Here I want to thank IIT alumni for the Wheels initiative, which facilitated this generous donation for this center. And we hope that through IIT Wheels and IIT alumni, we will link to other technical and leadership and business acumen which they have accumulated over the years. And we can tap into the 9,000 strong IIT alumni network in US and other countries. With this, let me thank Director of IIT staff for this very interesting and futuristic collaboration between a large institution and between a very relevant institution to public health. I wish that these centers will help transform maternal child health and water and sanitation. Finally, I am reminded of what Mahatma Gandhi said many years ago, that real wealth of the nation is its health, not the pieces of silver or gold. On his death anniversary, let's remind ourselves of this and work towards it. Thank you.